What if we just said we want to lead with love, recognizing that love is the all-purpose cleaner? Yay! Michelle asked me before we jump into a brief conversation with these two beautiful souls about what do we know about compassion and love as it relates to health. And so as a person living and working in the health sector, I wanted to talk a little bit about my journey around health and what we've been learning about this. I've spent my last couple of decades working to measurably improve the health of people and place. How do you build a healthy, sustainable, livable community? What James Rouse said, how do you build a garden to grow people in? And we did that work in about 400 cities across the country. My little Boulder-based business, an extraordinary work, and helped grow the healthy, sustainable communities movement across the nation over the last 25 years or so. And after the kids grew up and went off to college, Emmett's here with me, and his sister is 22 now, were asking me tough questions about, well, how are we doing? Is the country healthier as a result of all this work you've been doing? And some of you know that the Institute of Medicine came out with a report a couple of years ago saying that after 100 years of increasing the lifespan of human beings in the United States, almost 35 years in the last century, this will be the first generation where many of our children will live 5 years less than their parents. My daughter's question is, what have you been doing? So I decided to go on the line for health and moved out of Boulder, moved to Oakland, and took up work with the largest integrated nonprofit health delivery system in the country, and essentially be on the line for creating health. Health takes 20 cents of every dollar in this economy. 1 out of $5 goes through our sick care system. Don Berwick, the former head of the Medicare and Medicaid administration earlier in the Obama administration, said the healthcare sector is confiscating the wealth of the nation. So I said, well, what does it mean to go on the line for improving health if we're going to grab 1 of every $5? I went inside Kaiser Permanente because it's a nonprofit, mission-driven organization. Of our 200,000 employees, over 120,000 of them are unionized. We're represented by 28 different unions who not only make sure that we're paying a living, sustainable wage into the communities that we're operating, but they're saying, how do we make sure that absolutely everything we do, from our purchasing to our investment portfolio, to our environmental stewardship, to our hiring practices, build and generate health in the course of our business, not just through the care services that we provide. So what would it mean to have all in for health? Absolutely everything we do drive health. We have to ask the question then, what creates health? What are the determinants of health? Well, how many of you know what percent medical care has to do with creating health? 10%. So we spend $3 trillion a year. No wonder we have these kind of outcomes, because 10% is only what creates. 30% is our biological inheritance, and that's more in play than you know with what we're learning about epigenetics. But 60% of it has to do, Judy, with what you were just saying about our lifestyle and behavior in the places that we live and work and play. When it comes to what creates health and what is upstream from a $3 trillion spend, 20 cents of every dollar, place matters. As my good friend Tony Iton says, your zip code is more important in your health than your genetic code. Place matters. So what is it that we know about place? It caused us to start to ask the question as a healthcare provider, instead of, not quite this crass, but instead of you coming in as a patient and saying, what's the matter with you? We flipped the question to, what matters to you? Who are you? Where do you come from? What do you care about? Michelle, to your point, what's your purpose? Who are your people? Where do you belong? So that we could begin to get upstream from what creates health in the first place. I'll tell you what creates health in the first place. Michelle, you put these values up on the stage from the beginning. Well, when it comes to health, ownership matters. Place matters. Opportunity matters. Nature matters. Relationship matters. Those are the determinants of health. That's actually what drives in the first place. So what we're looking at is how do you bring this massive sector in the United States to engage in not only compassionate care, where we wrap the community around clinical delivery, but how do we actually address what creates health in the first place in a meaningful way? So our motto right now is all assets for health. What matters to you, and what we know is purpose and belonging are upstream from what creates health. So a health delivery system, we know we need to move ourselves that way. And so what I'd like to do is invite the two of you right to the edge of the stage with me, and I'd like to ask you a few more questions about what you think a compassionate way forward looks like. Thank you.